Fentanyl, one pill destroying lives and tearing families apart.
It is a horror that you live every day.
We're taking you to the front lines.
Some of them that, when they are ready to get clean, the help is not there.
Showing you what's being done.
It's the greatest drug threat law enforcement has ever faced.
And what new strategies may save lives. Welcome to the Faces of Fentanyl, attacking the fentanyl crisis. Now, here is your host, Amanda Barren.
Hello and welcome to our Tonight Live special report, The Faces of Fentanyl, attacking the fentanyl crisis. While it may seem like fentanyl has been a problem in our region as long as we can remember, it did have a beginning. And those whose lives have been affected, those using, their families, medical professionals, lawmakers, and so many others are looking for hope that it will have an end. So the question tonight, how did we get here? Fentanyl was first developed in 1959. It is 100 times stronger than morphine and used to relieve pain. It wasn't until 2011 that overdose deaths started to become a problem in the United States. The Centers for Disease Control and Prevention says there were an estimated 74,702 fentanyl-related deaths in 2023, down slightly from the year before. However, it still remains a drastic increase from 2011, when that number was at 2,666, according to the Drug Enforcement Administration. Preliminary data from the West Virginia Bureau for Public Health shows there have been 320 fentanyl-related deaths in West Virginia through June of this year. There were 1,133 such deaths last year. As for the efforts to get the drug off the street, the DEA reports confiscating more than 36 million fentanyl pills just this year, along with more than 5,000 pounds of fentanyl powder. So what's being done to address issues related to the drug across West Virginia? For starters, the West Virginia First Foundation has announced it's opening up applications to distribute its opioid settlement money. With hundreds of millions of dollars in the organization's control, many people have called for transparency and accountability with how the nonprofit will distribute the money. The director says there are mechanisms in place to address these concerns, including reports from the organizations that receive that money.
At the end of each year, we not only serve as a aggregate of funding, but an aggregate of data. And we have to publicly publish these reports that come back in. We want eyes on from ourselves, our board members, our committee, the expert panel, but also every West Virginian.
The applications for the initial opportunity are due October 5th, with West Virginia First planning to announce the recipients on December 31st. Fentanyl is a problem for those using it, as well as law enforcement trying to prevent its distribution. Jalen Lamp gives us a look at the challenges this deadly drug presents.
West Virginia is no stranger to drug epidemics, as it currently faces the opioid crisis head-on. But in recent years, the trends of prescription pills and heroin have made way for a substance best known as a one-and-done killer, fentanyl.
It's the greatest drug threat law enforcement has ever faced.
Chemicals in fentanyl are supplied from China, manufactured in Mexico, and distributed through major drug cartels into the United States. The drug has gained popularity with dealers for how cheap and easy it is to create. In contrast, heroin requires a longer process period and expenses for manufacturing. Fentanyl's lower cost means greater profit.
I've never been into using drugs. I don't know what it's like to get that high, but I could tell you from chasing money, it's an adrenaline rush, just like riding a roller coaster.
When it falls into the hands of a first-time user, the results are often deadly. And yet, that doesn't deter users.
It's one and done. That whole era of experimentation is over now. Young people used to be able to try something that maybe their friend shared with them at a party and live to tell about it. And that era is over.
When you have these overdoses and people hear about it, wherever that person got that from, the next person wants to gravitate to the same place because in their eyes, that's where you get the good stuff.
When drugs like meth and cocaine are mixed with a low dosage of fentanyl, it creates a greater addiction and an avid customer. Statistics have shown that those pressed pills are affecting adolescents more than any other age group, as they may think they're buying Percocets or Adderall.
The trends in the United States show that children in that age category are using drugs less frequently. So drug use is trending downward, which is fabulous. I think alcohol use is trending downward as well, which is fabulous. But the drug deaths are trending upward. So how do we have it that they're using drugs less often, but they're dying more frequently? It's because of fentanyl.
According to the American Psychological Association, 1 out of every 5 police calls involves a substance use or a mental health crisis. And while law enforcement are trained to provide help, the badge can sometimes be a barrier. Eric Miner rode along to observe a new policing program that puts people who are in recovery out on the front lines.
The opioid epidemic is everywhere.
Law enforcement is just a singular approach, and you certainly cannot arrest your way out of these types of issues.
6 months ago, the Buchanan Police Department added peer liaison Erica Bennett to its staff through a state-funded grant and a partnership with Charleston-based nonprofit First Choice Services.
My story is a little different from other people's. I was in and out of jails and institutions.
She's been in recovery for 5 years. The last time she was incarcerated, she was offered treatment through a drug court program.
And that's the biggest thing. Some people were scared to ask for help for fear of judgment. And that's kind of where I come in.
Each day, Bennett and her partner, Corporal Angel McCauley, walk a beat that's off the beaten path, checking in on known hangouts and encampments.
When I was solo without Erica, seeing the badge, people immediately thought they were in trouble. So having someone who's not necessarily in uniform benefits us a lot because it takes down some of those walls.
The last time they saw this man, he was overdosing.
Oh, how have you been?
I'm doing pretty good. I just got out of jail.
You just got out of jail? Hey, listen, so this is Erica. Erica is with our peer liaison.
Today, the mission is to help him find permanent housing.
And you guys don't have to come to the office at the Buchanan Police Department. I can meet you out if you don't feel comfortable coming there. I understand. I used to not feel comfortable there either.
With each encounter, Erica shares her contact information and a reminder about resources for shelter and recovery services.
Hello? Well, you know you guys can call me if you need to go somewhere.
So far, they've guided over a dozen people to substance abuse treatment.
A female that I had helped to get into treatment, she walked up to me and she thanked me for helping her and told me she had a couple months put together without substances at that point in time. So that was a really proud moment for me.
I think having us together, not only does it show people that we're doing more for the community, but it kind of humanizes the badge.
Do you like the job?
I love it. I do, I love it.
Once they make that choice, it's no longer their choice.
Still to come on this Tonight Live special report, we'll hear from a mother still feeling the pain of losing her son. That's next on the Faces of Fentanyl, attacking the fentanyl crisis. We'll be right back.